Hey everybody, this is Ryan here, and I'm going to do some teaching today, post-operative site care and dressing changes. And to help me teach today, this is my girlfriend Lauren. Our target audience is going to be English-speaking post-operative patients 18 years and older. First, I'm going to go over the teaching instructions with her, and then I'm going to teach her how to change the dressing, and then she's going to demonstrate back how to change the dressing. So what is an incision? An incision is a surgical cut through which an operation is performed. Some incisions are small and others are very long. An incision can be closed with sutures on the outside of the body. Other incisions are closed with surgical staples, which provide added strength to the incision. How do I care for my incision? An incision should be kept clean and dry at all times to help promote healing. If your doctor permits a tub bath or shower, you can gently wash over the incision. Make sure you rinse all soap and water off and then pat dry. If you're not permitted to get the incision wet, follow your doctor's specific orders for cleaning the incision. Never apply any type of cream or lotion to the incision unless your doctor tells you to. You should also avoid wearing tight clothing that rubs against the incision while it is healing. You're going to want to inspect your incision in the morning and at night to check the progress of healing. Contact your doctor if you notice any of the following: increased redness around the incision site, increased pain at the incision site, swelling at your incision, drainage coming from or around the incision that smells like pus, bleeding from the incision, or a temperature above 100 degrees for more than 4 hours.
Okay.
What if I have a dressing over my incision? A dressing is a clean cover over an incision. A gauze dressing is secured to the skin with surgical tape. Some dressings are clear and adhere to the skin without tape. The purpose of a dressing is to keep the incision clean, dry, and protected for the healing process. A dressing also absorbs any drainage that may come from the incision or wound. Sometimes dressings are used after a medication is applied to the incision or wound. The dressing keeps the medication in contact with the incision. How should I change the dressing? Alright, now we're going to go over changing the dressing. First thing you're going to do is wash your hands. Next, you're going to remove the dressing and put it in a plastic bag to put into your trash. You're also going to be gathering your supplies before you start removing the dressing. Okay, we take off our ACE bandage. Oh yeah, we're going to put it in here. Actually, we'll leave this one out. We'll take this one and put it in the trash. Okay, now we're going to inspect our incision site, make sure it looks like it's healing properly, which it is. Next, we're going to reapply a new dressing. So we're going to wash our hands again, put on gloves, okay. Start off with a gauze sponge. Take it out of the package. Place it over the incision, like so. We get our roll of gauze here. Redress the incision. You don't want it to be too tight. That'll cut off circulation. Then we'll secure our dressing with some tape. Next, if you wish for more support, we'll add an ACE wrap. How does it feel, Lauren?
That's great.
Good. Now you're going to demonstrate back to me how to change your dressing.
Okay. Gonna make sure all my supplies are gathered
Good.
and ready. Have a plastic bag to get rid of my old dressing. Make sure I have a clean surface to work with.
Mhm.
Wash my hands. Take off the old dressing.
You got 40 seconds.
Okay. Put that in the bag.
Mhm.
I'm gonna look at my incision, make sure there's no signs of infection like swelling, redness, drainage, or foul smelling odor around my incision. Put on gloves. Wash my hands first. Make sure it's not too tight and constricting. Secure it with silk tape.
You don't have to put this on.
And then if I like, I would put the ACE wrap on top of it.
Good job. Do you have any questions?
No.
Okay, good job. Thanks for watching. Oops.